So today we're going to talk about some information about teen pregnancy. And I want to be really upfront. I'm not an expert in this, but recently I've had a couple conversations with clients, kind of colleagues and friends about teen pregnancy and just kind of like general information and statistics about it. And it caused me to do a little research and see that there's definitely some myths out there that I want to make sure we discuss today. So before we get started, once again, I want to introduce myself. My name is Dr. Egan. I am a child and adolescent therapist and a parent coach. And I offer these free parenting webinars I used to offer them every Monday, but I decided to switch to the first and third Mondays of the month. And really why I made that change was because this is just a really busy time for me in the year. Every year, the beginning portion of the year is very, very dense as far as my schedule. And I just really wanted to make sure that I continue to provide high quality information and take the time needed to be able to explore the topics that we discuss just in an appropriate way. So I really encourage you to join these webinars live, because the benefit of that is that you get to ask questions and then I can answer them in real time. But if this time doesn't work for you, or you're a person who would rather watch videos late at night, like I do sometimes, then absolutely get the recording sent to your email and you can watch it at your convenience. And you can always send me a question via email if you have any remaining questions. My training, I have a doctorate in school psychology. I have licensure as a mental health clinician. I have a private practice located in Charlotte, North Carolina. And I have several specialty areas, but two of the specialty areas that I focus on the most are supporting parents as they manage technology and social media in their home with their children, and then also working with families who are going through a separation or divorce or becoming a blended family. And then anxiety is a real source of topic for families I work with. I have a podcast that I co-host with my teenage daughter called One Day You'll Thank Me. And we have new episodes that come out every Wednesday. And we do a lot of interviews where we talk to experts about a particular topic. So the episode this coming week is we are talking with Mandy Zucker, who is a grief specialist. And she is on a mission to support teens and college students who have experienced a loss, and making sure that they can handle that loss in a really healthy way and get the support they need in college. So it's a really interesting interview, so I encourage you to check that out. So, talking about teen pregnancy, I wanted to start off by just talking about some statistics, and I made sure to get the statistics from really well-regarded organizations. If you do some Googling, you'll find that there's a lot of sources that come from kind of biased sources. Either they're really religious, it'll be cited by a church or something like that. That's not really a well-regarded or established research organization. So I focused on the CDC and the World Health Organization to make sure that I had data that was as up-to-date as possible and really reputable as far as their research methods. So high school students who report having sex has decreased over time. So when they survey high school students and ask them about their sexual activity, we see that over time, kids are having less sex. So from 1991, there was a report of 54.1%, but in 2019, that number had dropped to 38.4%. And really, the CDC does not offer an explanation, like what the causality of that statistic is. I definitely think that the fact that kids do so much more socializing over the internet could be a variable, and that kids oftentimes have, really structured schedules and they interact with their friends and romantic partners over the internet. So there's a little bit less in-person contact. The birth rate for teens 15 to 19 years old in the US has fallen by 60% since 2007. So what's really, though, important to recognize is that teen pregnancy rates, because there's a birth rate, right, which is that we're talking about babies actually being born. And then there's teen pregnancy rate, which is kids getting pregnant, teenagers getting pregnant. because a lot of times we have teens who get pregnant and they don't end up giving birth. So whether there's a problem with their pregnancy or they terminate the pregnancy through abortion, I just want to discriminate between those two terms. So we know that the birth rate for teens has fallen by 60% since 2007. And we also know that teen pregnancy rates amongst white kids have declined significantly, but among the Black and Latino population, that decline isn't as significant. Okay, and we also, one of the variables that's been proposed about this statistic is that there is a distrust in the health system in those populations, and so that can impact the relationship between teenagers of color and being provided with medical care, contraceptive, accurate information, things like that. So we do know that babies born to mothers under the age of 20 have higher risks of low birth weight, preterm delivery, and significant health conditions. So now, whenever we look at data from the World Health Organization, it's important to understand that that's worldwide data. CDC data is really more specific to the United States. So we do want to keep in mind that with the World Health Organization, they're also including data from third world countries and things like that. So I just want to make sure to clarify that detail. A couple other facts that I want to make sure that are understood is that most teens, if they seek a sexual relationship, they really do express a preference to do so in a committed partnership. So sometimes individuals in the older generation make assumptions that kids who are sexually active or teens who are sexually active are doing so in a really indiscriminate way. And in reality, when they seek information from teens, teens do express that they want to feel like they're in a committed partnership. Another thing that's really important is that teaching about contraception does not encourage teens to have sex. So what can actually happen is that it can delay intercourse until an older age. So when kids are really informed about their bodies, about the choices that they have with contraception, about the physical and emotional consequences of sexual activity, oftentimes that results in them delaying sexual activity or sexual intercourse till an older age. Some factors that reduce teen pregnancy rates. So there's several factors, and when I go on to the next slide, and I guess it's a couple slides from now, there's going to be more detailed information, but there was two primary factors that really stuck out as being the primary factors that reduce teen pregnancy rates. The first one is exposure to clearly presented fact-based sex education that's free of messages of shame. So it's really important that kids get accurate information and that the focus of the conversation isn't, putting this kind of overlay of values or, whether or not you're a good person or a bad person if you engage in sexual activity. So when kids can get that information and it's exposed at a young enough age where they can use that information to make decisions, that is always preferred. We also know that access to low-cost contraception, particularly long-acting reversible contraception, so these are things like IUDs and implants, where there's less room for human error. So kids or teenagers who are sexually active and they're relying on daily contraception or contraception that's supposed to be used in the moment, like condoms, we see that kids are less reliable with that. So if they're able to use a method that takes out some of the human error and the consistency that's needed to protect themselves against pregnancy, then we see better outcomes. So that's something that's really important, is that we make sure kids have information about all different forms of contraceptions out there. Okay, I wanted to mention this. I stuck this slide in at the last minute because it's just a video that I've seen several times. And if some of you are familiar with John Oliver, and he does a show called Last Week Tonight, and I believe it's a weekly show. It's like a talk show. He's super intellectual. He's British, but he did an episode way back in 2015, and I believe it's called Sex Education. And here's the link if you are so inclined to go and look it up. But he basically does a show on how much disparity there is in sex education around the country. So he talks about if you're a student who lives in, for example, South Carolina, your child's exposure to sex education might look completely different than students who reside in Minnesota, for example. And so he talks about how there's times when kids are given really factual-based information, how there's a very specific program that students are exposed to. And then he also talks about how there's other places that really blatantly give inaccurate information. It's filled with shame, or they have put a lot of rules on the instructor as far as what types of words and things that they can use. And in the video, he talks about how a teacher was not permitted to use the word condom during instruction on sex education. And then he showed how that teacher got around being able to communicate about condoms without actually using a word. It was very interesting. So it's probably a video you would want to preview before you showed it to your children, just because there is some adult language in there and references to more mature sexual activities. I didn't hesitate to share it with my children, but I am definitely very sex positive in our house. So I just wanted to give you that warning, but it really does a great job sort of indicating or describing the disparity across our country when it comes to sex education. This slide talks about some more specific information about risk factors versus protective factors when it comes to teenage pregnancy. So some of the risk factors: living in poverty, having a mother who has limited educational achievement. And I do want to take a minute and just talk about this, because I have an anecdote to share. I was working with a client once, and we were talking about her future goals, and she was just a really nurturing, caring kid. And she said, I really want to be a mom someday. And I was like, oh gosh, that's wonderful. And she said, so I just don't know that I'm going to go to college, because that's really what I'm interested in doing. And I said, and I wanted to make sure she was educated. And I said, do you know the information about how kids who have more educated mothers oftentimes demonstrate kind of a healthier adjustment? And she, we talked about it more specifically about how because mothers are so often the primary caretaker, they have such an influence over their child's development. So if a mother is undereducated, then it impacts the child's overall development. So we talked about how being an educated mother was a part of being prepared for motherhood. And obviously that doesn't apply for every person. I don't want to imply that if you don't have a college education, you're not a good mother. But I really wanted this child to know that getting a college education is a form of good parenting, because you're coming from an educated place. Another thing that's a risk factor is having a mother who gave birth before the age of 20. So if your mother was a teen mom, then that's a risk factor for that mother's child to be a teen mom. Coming from a family with high family conflict, having early exposure to drug and alcohol use, having low self-esteem. And when I was talking about this topic with my daughter, some of you know my daughter because she's on the podcast, Anna, and we had a conversation about this because she's been taking a child development class, and one of the things they talked about was teen pregnancy. And she kind of laughed, and she was like, how is this anything? Like, how is having low self-esteem related to teen pregnancy? And so we sort of talked about how decision-making can be very different when you are a person who has a sense of future and really feels like their goals for themselves are defined and really feels a sense of ownership over your body. And so that, she was like, okay, I get it now. But to her, it seemed like a really random thing to say. And then being raised in a single parent home is a risk factor too, which I was really reluctant to write down, because that seems such a simplified, sort of superficial thing to write, because there's just so many factors that go into like the quality of parenting that occurs in a single parent home. And sometimes the quality is so much higher than a parent being in a marriage or in a relationship with a co-parent that isn't healthy. Some other things I want to note from this slide is just the protective factors. If you're a family that has really open communication between parents or adults in the home with the children in the home about accurate contraception use, that is a very strong protective factor. Having healthy family dynamics, having friends who use condoms or use contraception. If it's normalized to use contraception, if it's something that is just a standard of behavior amongst your peer groups, then you're more likely to adopt that behavior yourself. If you're a person who has an intent to abstain or limit the number of partners, we know that's a protective factor. And then a couple other points on this slide is just talking about local and state policies that allow kids to have easy access to information, to contraceptives, to medical professionals. You know, if your child, say, for example, they live in a rural area and it's really difficult for them to get transportation to a medical facility to get informed or get contraception, then that can really impact a child's ability to do what they need to do to protect against teen pregnancy when they're really young. So we know that there's some community factors that relate to teen pregnancy. So it's really important to think about that. If you're a parent and you live in a community that doesn't have these resources, then obviously your child is going to be more dependent on you really making a point to stress that information and make sure that they have access to what they need. All right, I did want to take a little bit of time just to talk about some simple ways to talk about sex with your child. Honestly, before we even get started, I do want to note that for some parents, the barrier is their impression of what the sex talk looks like. A lot of times parents think, especially because it's talked about a lot on like TV shows and things, it's like the talk. Like there's this one magical day that you sit down and you have this talk with your kid, and this is your chance to sort of give them the information they need. And oftentimes the people associated with it being really awkward, and the child's embarrassed, and the parents are self-conscious. And I really just want to disabuse parents from considering it as like their only option. If you're able to cultivate conversation about bodies, about the reproductive system, about sexual behavior, about the emotions that go along with it from an early age, then it becomes a conversation that occurs like maybe in brief moments, but many times throughout the kid's childhood. And so I really encourage parents to take advantage of everyday moments. So if you're watching a TV show and some sort of sexual topic comes up, or you're perusing your child's Instagram and there's, you know, a meme, or there's a comment that one of their peers made, then it's really a great opportunity to have a discussion with them about it. And it can be lighthearted, there could be jokes involved, there could be, some gentle sarcasm. Like it doesn't have to be like, we need to have a talk about this. But there's a lot of times where I can assess sort of what my kid's knowledge base is based on what I learned that they understand. So if we're watching a TV show and there's some sort of innuendo made, or there's a joke, and I'll be like, do you know what that means? And sometimes they can tell me, and sometimes they like have it completely wrong. And then it gives me an idea. Is this a phrase they're familiar with? Or why is this funny? Or why is it a joke that was made that maybe even isn't that funny? So I've learned a lot about what my kids understand through them hearing dirty jokes, where a friend or something on TV, a comment is made and they laugh. And it lets me know, like, okay, this is something they have familiarity enough to laugh about. So let's talk about it maybe a little bit more. Be honest. There's some things that make us really uncomfortable. And there's some things, honestly, we have to Google. I know not that long ago, I was playing a game. Thankfully, it was with only adults. And it was, let me think of what the game is called. Cards Against Humanity. And there's a lot of sexual terms in that game, and it's really fun. But I had to do some Googling to make sure that I understood some of the terms that were on my cards. And I, kind of had this realization, like, I don't necessarily know all the answers. So it's okay to tell a kid, like, let me find out more about that and get back to you, than to just dodge the question or say something that could potentially be false. So, and I think that it's okay I think it's really important to be mindful about what your boundaries are as far as what you reveal about your own sexual history or experience. Your sexual background is your business. And there's times when kids ask really innocuous questions, and that's fantastic. But I know for me as a parent, I kind of had a like, hey, let's not talk about mom's sexual history, because what's the line between saying, oh, I had my first kiss when I was this age, versus saying details that once you say it to your kid, they can't unknow it, and then that could potentially be uncomfortable for them. So it's sort of walking the line between sharing enough of yourself so that you can have an open conversation, you can convey information without shame, but that you're not breaching your own sense of privacy. So that can be a little tricky, and that can change over time, especially as your child gets older. You might have a different relationship and a different communication style with them, but just kind of be self-aware about what you feel comfortable about. Being direct, using really accurate terms is important. Making sure you present risks about sexual activity, but trying to do so where you convey your feelings. It's okay to share what your values are, but to avoid using really shaming language, like you're a bad person if you do this, or you're a bad person if you enjoy this. Sometimes just starting off in a really matter-of-fact way and then easing into a conversation about the potential emotions that can occur, or if there's any kind of collateral damage that comes from engaging in a certain behavior. I think that's something that's important as parents for us to educate our kids on, but to imply that if they make different decisions than you would prefer, that they are, bad people, that's probably going to close off conversation pretty quick. It's important to consider your teen's point of view, not to lecture, not to use scare tactics. This generation has a very different view of sexual activity, posting naked pictures, sexting, than our generation did. And it's important that they know the risks of engaging in that behavior, but it really is a different generation for that. And it's important that we listen to our kids and really understand what's been normalized for them versus immediately going into a mode of lecturing. We're going to talk about consent specifically. Like, I'm going to have a separate webinar specifically about how to discuss consent with your children. So I'm going to pause on, that aspect of this slide, but I did think it was something that's worth mentioning, but I hate to go into too much detail because there's a lot of information about this topic that could be really helpful. And then making sure that kids know that you're welcome to have discussions. You welcome their questions and that you appreciate them coming to you, because it's really important to keep that connection going, and for kids to have the sense that they can come to their parent and ask questions versus them only looking for sources on the internet or going to friends to figure out answers to the questions they have. Okay, so that's some information about teen pregnancy. Like I said, it was just kind of some brief information to think about. Next time we talk, which is going to be in 2 weeks on February 1st, we're going to talk about spanking. So that is a topic that's come up a lot lately, and I've seen a lot of commentary on the internet about it, like on my Facebook groups. So I do want to make sure that I share some research about it and what some general recommendations are about spanking. So if that's something you have questions about, I want you to make sure to come back. Looks like we have a question here. Okay, so the question here is, should I be concerned about my teen learning about sex through pornography? Yes, you should be concerned about that. In fact, we know that pornography is one of the primary ways that kids learn about sexuality. And when I say they learn about sexuality, the fact is that is not a good source, because it presents sexual activity in such an unrealistic, biased, oftentimes really unhealthy way. So I do think that parents really educating their kids about pornography in the scope of their sex ed, and understanding that kids are going to be exposed to it. It might be for a few moments while they're in lunch at school and a peer shows them a dirty picture on their phone, or it can be something that they spend extensive time looking at when parents aren't home. So kids, though, are going to be exposed to pornography, and we don't want them to get the answers to their questions through pornography. We know that those are videos that convey very unrealistic physical relationships, how men and women present themselves are not representative of a healthy and realistic sexual relationship. So it's really important that kids get information from accurate sources. They understand that sex doesn't look like it does in those pornography videos, and that kids understand what pornography is, the impact it can have on their brain, and they know the risks of becoming dependent on pornography if it's something that they're exposed to extensively. So that's a really important part of sex education. And that might not have been as relevant of a topic as it is now than when I was young, but it really is important for parents to, teach their kids about the risks of pornography. Let me see. I don't think we have any other questions here. So we will finish up for today. As always, here's my contact information. Anybody can email me if they'd like at drtaraegan@gmail.com, or tune in to the podcast every Wednesday. So thank you for listening, and I will see you back here in 2 weeks. Have a good day, everyone.